Hi class, this is Latasha Woods, and I'm going to be doing my week 7 virtual class assignment, which is the conflicts of interest on the topic of medical malpractice fact pattern. And I chose this particular topic because it's from my own personal experience that was never pursued by an attorney. So basically, this is some of the information in this story is are facts, and some of them aren't. They're fiction. The hospital name I've named in this case is make believe. I've never gave any patients' names or doctors' names or anything like that. But for the sake of this assignment, I pretty much just went with the flow of it. But basically, the story goes as young mother gave birth to a baby, and after about 4 months of the baby's birth, the mother started experiencing pain in the lower part of her back. She went to the emergency room at Charleston Memorial Hospital. The patient explained to the doctor her symptoms, and he made a prognosis. After obtaining a urinalysis, she was ultimately diagnosed with a UTI, which is acronym for urinary tract infection. The doctor prescribed necessary prescriptions and sent the patient home with instructions. Don't know, the name of the prescription that she was sent home with, but basically, anybody who's ever had a urinary tract infections, you can't drink a lot of sodas and, especially the teas, things like that. And so patient went home. She was being careful with the things that she ate and drank. She took her medication as prescribed, and the symptoms started demising over time, but yet it wasn't completely gone. Patient had these recurring symptoms, the same type symptoms for months. And again, she was diagnosed with the same medical problem, which is the urinary tract infection. And again, was sent home with the same type of instructions, the same type of prescriptions, which basically it was prescriptions for a urinary tract infection, but it wasn't the same kind. It might have been a little stronger type for her. On December the 12th, 2000, approximately 9 months after the baby's birth, the patient collapsed in the middle of a local Walmart store after she was doing some Christmas shopping for her daughter. The patient was admitted to Charleston Memorial Hospital, where tests was ran, and she was discovered to have cholelithiasis, which is a presence of gallstones in the gallbladder. It was discovered that the patient had this problem since giving birth to her baby 9 months earlier. The underlying symptoms to this cholelithiasis are similar to the symptoms of a urinary tract infection. So basically, when the patient was given the doctors the symptoms, they was like, okay, it might be this, but we're going to check your blood and we're going to check your urine to see this, that, and the third. The patient did have a urinary tract infection, but the discovery of the gallstones were never done properly because there weren't any tests ran other than the urinalysis and the blood tests. The patient had an emergency cholecystectomy, which is the removal of the entire gallbladder. Unfortunately, the patient passed away from the complication of the surgery, for which the organs in her body began to shut down. The patient's family sued Charleston Memorial Hospital and the emergency room doctor for negligence and misdiagnosis. The emergency room doctor did not give the proper tests that were needed to discover the gallstones, such as an ultrasound or maybe even an MRI. The case was handled by an attorney who decided to take this malpractice case for the plaintiffs, which are the families of the patient. Upon reading the facts to the case, the attorney later found out the emergency room doctor is actually a distant relative of one of the partners at the law firm, which was never disclosed. I don't know how he discovered that, but it was discovered that the emergency room doctor who was treating the patient prior to her having the surgery is actually a relative of one of the law firms for which the patient's family had hired to take the case. This created a conflict between the patient's family and one of the law firm partner's family members, who is the defendant to this case. The attorney ultimately withdrew from representing this case, causing the family to seek counseling elsewhere. That's basically my example of the medical malpractice fact pattern. Thank you all for listening. Bye-bye.